Even without proper confirmation with regards to the presence of the deadly Delta variant in Guyana, the Minister of Health, Dr. Frank Anthony, has once again expressed the belief that the upsurge in new COVID-19 infections, hospitalizations, and deaths locally is as a result of the presence of the Delta variant. This view was shared by the minister on Tuesday during his COVID-19 update.
I really want people to understand that we are in a Delta surge. We are going to see more cases, unfortunately more hospitalizations and more deaths. We can prevent these things from happening by our actions.
There are no tests currently being conducted for the presence of the Delta variant in Guyana, since according to the minister, testing for the variant is nonsensical, even as a latest report from Trinidad has indicated that a traveler returning from Guyana tested positive with the Delta variant. The Delta variant has been wreaking havoc in over 140 countries, and now that it has made its way on Guyana soil, the Ministry of Health has begun preparation to accommodate an increase in patients.
So it is going to be challenging going forward as we get more and more hospitalization. We have already spoken about other contingencies where we might have, if it becomes necessary, close some of the services at other hospitals and convert those hospitals solely for COVID patients. So we'll activate the field hospital as well. So we have considered some of the next steps if the cases go up. And the medical team at the hospital, at the Ocean View facility, have been looking at this very closely.
145 new cases were recorded by the Ministry of Health in the last 24 hours, increasing the total number of active cases to 1,933. It was reported by the Ministry of Health on Monday that 104 persons are hospitalized with COVID-19. However, on Tuesday, that number increased to 111, with 33 patients in the COVID-19 ICU at the Ocean View facility. 5 COVID-19 related deaths were also recorded in the last 24 hours. The minister also conveyed that the intensive care unit will be expanded to accommodate at least 50 patients. At present, the unit has a capacity for 40 patients. Persons were further encouraged to access the COVID-19 vaccines. While 313,469 persons have received the first dose of the vaccine, it was conveyed that persons are not returning for their second doses.
But when we look at the second dose, it's only 161,022 persons who have received their second dose. Now, while we do have a shortage of the Sputnik V second dose, there are lots of people who have taken the AstraZeneca vaccine that can come back and get their second dose within 4 weeks to 12 weeks. Anytime within that period, you can come back and get your second dose.
Meanwhile, as the robust adolescent vaccination continues, it was announced that the vaccination drive will be expanded to Regions 3 on Friday and Region 6 on Saturday. Further, adolescents residing in the hinterland will see the vaccination rollout in their communities as early as next week. Reporting for the HGP Nightly News, Kendell Richmond.